Mr. Chairman, thank you very much. Thanks to all of our witnesses. Mr. Heimel, you have not been on the job that long, less than a year still, I think. Is that right? Or,
yes, sir.
Yeah.
8 months.
And I wanted to commend you because I know you came from being the director of the Walter Reed National Military Medical Center in Bethesda. But you've definitely brought a lot of focus and purpose to the task here. And I have a number of constituents, a whole lot of constituents who go down to the DC VA, and they continue to have problems, but we are aware that you are trying to respond, and you've certainly been working well with our staff when we call up. And I understand you're doing these monthly meetings with congressional staff members.
Yes, sir.
And also with the other interested stakeholders. And so I want to thank you. I want to thank Ms. Wimberly from your staff, who I know has been very helpful to us as well. The morale situation is very tough with a lot of the employees there, and I wonder what it is you're trying to do to address that, and to what do you attribute it? What is your sense of the situation there?
Thank you, sir. I think it's probably one of the top two challenges that we have at the DCVA is employee engagement, morale, and commitment. The chairman referenced the survey that we are in the process of retaking for 2019. And to put some things in perspective, in 2018, 2017, we had 34% participation rate in that survey. This morning, we had more than 65% of our employees who took the all-employee survey. That is going to give us some very powerful feedback on the pain points of their everyday work environment that we can put action plans in place with them and actually have employee-led groups to improve them. I think the biggest challenge our employees have had has been psychological safety and fear of retribution should they report a medical error or should they report a mistake that they made. And that is a culture that we are trying hard to break and encourage people to speak up. And I'm encouraged by the data that we're seeing. In 2018, there were about 780 patient safety reports filed by our staff. Now, that may include a patient incident. It may include a near miss, like a patient, there was a question about a patient getting the right medication delivered the right way, and a staff member did the right thing and asked the question, and we asked those to be put in our patient safety system so we can trend what is happening and we can look where we need to make process improvements.
Is that the kind of fear that whistleblowers experience, a fear of retribution?
Yes, sir. I believe that's part of it. And so what we've seen this year so far is we have about 870 patients. We have more patient safety reports now than we had all of fiscal year 18, and 80% of those reports have a person's name on it, so we can follow up with them. We can ask them what they've done, what the issue was, and we can give them feedback on what we're going to do to prevent it from happening again.
So you're trying to dispel this culture of fear, which is a hangover from what, prior leadership?
Yes, sir, I believe so.
Okay. Well, thank you for that. I have received a couple of complaints from constituents about the IT situation and a huge backlog in requests for IT assistance. And obviously, today, you really can't run a functional organization if you don't have effective IT. Can you explain what is behind that and what you're doing to address that problem?
Yes, sir. There is a significant backlog. As of this morning, I talked to the area manager who reports up to the assistant secretary for OI&T, and there are about 4,000 open work order tickets within the DCVA and our 6 outlying clinics. They have had a significant problem with staffing in the past. They are almost fully staffed now. They're authorized 25 people, and they have 22 on board, with 2 more being recruited and 1 person who just left that they've got to process the action on. The team is very engaged. Mr. Gaffair, the Assistant Secretary for OI&T, visited the hospital about 2 months ago and spent an hour with the area manager talking about the issues and challenges. And these concerned me a great deal because as we get ready for the electronic health record deployment at some point in the future, I need the IT team really working on upgrading the infrastructure of the facility and not working on a backlog of IT tickets.
Okay, finally, would you be willing to compare your experience at Walter Reed with your experience at the VA? The Walter Reed really now is a hyper-efficient, up-to-date, state-of-the-art kind of facility, and can you compare that to where you are now and to what you would attribute the difference?
Sir, it really gets to leadership, and it's a very different patient population. At Walter Reed, primarily retirees, active duty service members, and their family members. At the DCVA, we do have a large portion of our population that is economically challenged and financially challenged, or financially insecure would be the best term for it. Their healthcare status and their engagement in their healthcare is different than it was at Walter Reed. I think the other piece of it is Walter Reed was an incredibly highly functional organization when I got there. Routine things happen routinely regardless of who the leader is. And I followed two very talented leaders in Admiral Mike Stocks and Major General Jeff Clark. At the DCVA, the struggle has been and was routine things happening routinely, and how we build that into our culture and empower our employees to just make those things function every day, regardless of who the leader is.
I thank the gentleman.